Hi everyone, it's Wednesday. It's Snowmageddon Wednesday. Hope we're on the backside of this amazing storm and inversion that we've seen as far as temperatures go. It's been very crazy, and I do hope that you all are managing. Hopefully you're having enough electricity and water to get through all this. It's been a tough time for a lot of folks, and just know that we're thinking about you and hope that this moves on very quickly. Today I wanted to visit with you a little bit about some of the things that I've been listening to. I've had a lot of time these last couple of days to listen to some podcasts, and the thing that keeps kind of rising to the surface is the fact that insulin resistance is just an incredible issue today in our world as far as our health is concerned. And that term gets tossed about quite a bit, but maybe a lot of you just don't really understand what that means. But before we even get to that, I wanted to talk a little bit about the fact that 90% of people in the United States have one criteria for metabolic syndrome. And metabolic syndrome is one of the ultimate issues that we see with insulin resistance. So I just kind of wanted to touch base on that first to cover those criteria so that you can understand perhaps where you fit in and then what we need to work on as far as trying to reverse that. So what are the criteria for metabolic syndrome? The first thing is being overweight, and in particular truncal obesity, meaning that midsection obesity. So depending on which criteria you look at, it appears that the simplest way to look at it is, for men, it's a waist circumference greater than 40 inches, and for women, greater than 35. So that's definitely a tangible something that you can measure and respond to and look to try to diminish. So truncal obesity is number one. Number two is triglycerides. And triglycerides is just the second piece of information we get when we do a lipid panel. And triglycerides, we want, the upper range of normal is 150, so we want it less than 150. And ideally, what I look for in most of my patients is trying to get it under 100. And we'll talk a little bit about what causes that as we talk about our continuum from normal metabolism to type 2 diabetes and this insulin resistance issue that we want to kind of learn about. So we have truncal obesity, elevated triglycerides, low HDL is number 3. For men, you want it greater than 35, and for women, greater than 39. And in particular, what I look at when I get a lipid panel is I also look at the ratio between triglycerides and HDL. And I want that ratio to be less than 2-to-1. So you do not want your triglycerides to be any greater than double your HDL level. And in particular, we see that an awful lot I've seen it quite a bit during this last 9 months with COVID, and that more folks are drinking more alcohol, and more alcohol can contribute to higher levels of triglycerides. And certainly carbohydrates and sugars do too, but I've seen it a lot more with folks drinking a little more alcohol, more wine. And then elevated blood pressure is next. You want that blood pressure to be less than 140/90. And under strict criteria in our office, as we try to optimize it, we really want that blood pressure less than 120/80. So we need to try to do everything we can from even a treatment standpoint to try to optimize blood pressure. And lastly is an elevated fasting blood sugar. Ideally, you'd like that to be less than 100. There are a few people who have what's called a dawn effect, that the elevation of morning cortisol can raise that fasting sugar a little bit. So many criteria keep it less than 110, but ideally you'd like that to be less than 100, and optimal is less than 85. So trying to lower your blood sugars is important as far as trying to minimize any of the criteria, meeting any of these criteria. So it's thought that 90% of people have at least one of these criteria, and in order to have metabolic syndrome, you have to have 3 out of the 5 to have that diagnosis. And as we are looking forward at health and healthcare and the cost of healthcare and what we're seeing as far as diagnosing this particular issue, we're seeing more and more and more people being diagnosed. It's thought that 1 in 10 people in America today, about 34 million, if not a few more today, are diagnosed with type 2 diabetes. And the cost of that is well over 150 billion, over 100 billion just in terms of medical costs, and then another 50 plus billion in terms of loss of work and disability and premature death. So it obviously is a huge, huge public health issue. And I think that although most of the folks that we see in our office are very geared toward being healthy, I think we still can all learn. And even if we don't have any of the specific issues here, we can certainly help those people that do. And it all does start with just how we choose to eat and understand what happens when we do take in food. How is that process? So let's just do a quick little walkthrough. Today, I want to just focus on what is insulin sensitivity. And to begin with, we'll just start with what is insulin. Insulin is a hormone that is made in the pancreas, and it is released in response to energy that is taken in as food. So we take in food, and in particular, we're going to talk mostly about carbohydrates. So we have a meal that is heavily laden in carbohydrates, and the stomach begins to break those down. We have amylase in our mouth that breaks down starches into simple sugars. And then in the small bowel, they're absorbed and are taken to the liver. The liver senses this income of fuel, and it stimulates this small gland underneath the stomach called the pancreas that produces the insulin to send insulin out into the bloodstream. And the liver then is responsible for deciding what to do with all of this energy that comes in. The liver has a choice of doing 5 things with these carbohydrates. It can use it as its own energy. It can send it out as just blood sugar, and insulin, because it's so powerful, tries to keep that blood sugar in a normal range. It can create glycogen storage, so it will store sugar in the form of glycogen in the liver, and the liver has a capacity of storing about 100 grams. And this is fairly fixed. This is not something we can increase significantly. The reason is that glycogen has a lot of water in it, and if we stored everything in our body, both in the liver and in our muscle, as glycogen, which are it's just a lattice work of glucose molecules, because there's so much water in it, we would never be able to walk around. And those stores are very important, because when we are active, that's where we go to unleash the sugar that we use to make energy. And then lastly, besides storing it as glycogen, it can package it as either triglycerides or cholesterol and then sent out into the bloodstream. But because these are fat type molecules, they have to be carried on a protein, and that's where these lipoproteins come from. The LDL, the HDL, these are lipoproteins, and the VLDL, the very low density lipoprotein, carries triglycerides and LDL on it. So that's where the triglycerides, how they can be carried in the bloodstream. And once it's then has been packaged and made, then insulin carries the sugars and the amino acids from proteins and these essential fatty acids into the periphery and basically send them into the cells. The muscle cells, for the most part, are the major target. And the muscle cells then absorb the energy, and if there's a lot of energy, it will be sent back out and sent to the fat cells, and that's where insulin will then send it into fat cells for storage, so that when that famine comes, we have a place to go for extra energy. But in a system that is very well balanced, meaning that you are expending the energy that is being taken in, then there's a great balance of the energy in and energy out. But typically, we as Americans, and certainly with the old standard American diet, will bring in much more energy than is required, and therefore we store an awful lot. And that's why we're seeing so much more of the issues being brought to light and going from this continuum of normal metabolism to diabetes. And so this is just a brief introduction to insulin. Next week, we'll talk a little bit about the counter-regulatory hormones, and then we'll begin to start this continuum from normal metabolism, stage 1, stage 2, stage 3, stage 4, and then into diabetes. Hope it's not too boring for you, but I really want you all to get a sense of what is really happening in the body. And for those of you that really need to work on these things, just want you to know what's going on. I think it's just so helpful to know what, from a physiologic standpoint, how these things happen. And it's not that you just wake up one morning and you're diabetic. This is something that goes on for years and years and years. And that's why knowing these things ahead of time, we can turn that train around and hopefully prevent that from happening. And so I hope you all have gained a little bit of knowledge, gotten a little pearl of wisdom here. I guess instead of just saying stay well, I'm going to say stay well and stay warm. And we will take this back up again next week.